We can start, ma'am, please.
Yes, sir. Om Shri Dhanvantare Namaha. Namaste, everyone. On behalf of Tribhuvan Holistic Health Foundation, I take the pleasure in inviting all our doctors and our esteemed speaker, Dr. Naveen Chandra Joshi, sir, for this 18th Vaidya Sammelana program. It gives me immense pleasure to join with you all. Now, I would call upon Dr. Shruti Shankar ma'am for invocation prayer. Thank you.
नमामि धन्वन्तरिम् आदिदेवम् सुरैर्वन्दितपादपद्मम् लोके जरारुभयमृत्युनाशम् धातारमीशं विविधौषधीनाम् धन्वन्तरिं रमानाथम् सर्वरोगनिवारकम् आयुर्वेदप्रवक्तारम् वन्दे पीयूषदायकम् सर्वे जनाः सुखिनो भवन्तु सर्वे सन्तु निरामयाः सर्वे जनाः सुखिनो भवन्तु सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः
Priya, ma'am, you are muted.
Thank you, Shruti Shankar madam, for rendering this prayer. Now, I like to welcome Dr. Gopalakrishna sir, Secretary of Tribhuvan Holistic Health Foundation, to address this Google Meet meeting and give an introduction to Tribhuvan Holistic Health Foundation.
ॐ गुरु ब्रह्मा गुरु विष्णु गुरुदेवो महेश्वरः गुरु साक्षात् परब्रह्म तस्मै श्री गुरुवे नमः। ॐ Namaste everybody. It gives me immense pleasure to introduce Tribhuvan Holistic Health Foundation, which was founded 3 decades back in the service of mankind in the holy city of Bangalore. Bangalore is known for its continuous evolution and also activity. To address the need of not just the Ayurvedic students, but also the society, Tribhuvan Holistic Health Foundation was founded under the able guidance of beloved Dr. B.S. Natraj sir and also Dr. K.S. Jayashree. Since the conception, it is rendering a human service throughout. To give the best of the service available, it is necessary to update ourselves, to learn the Shastra. Once we learn the Shastra, it is very important to put it into the practice. To put the thoughts into the practice, continuous training is also necessary to update ourselves, to improvise ourselves, to fine-tune our learning and skills. In doing so, Tribhuvan Holistic Health Foundation is regularly conducting Vaidya Sammilana, many Sammelanas, seminars and symposia, also hands-on training, and also serving the needy. Along with that, identifying the silent servers of the society, conferring the awards, celebrating our joy to enjoy more, to give the society not just the treatment, also to take care of the manas. All these things are addressed in Tribhuvan Holistic Health Foundation. I salute at the lotus feet of our President, Ma K.S. Jayashree. Today we have a coveted trainer, teacher, who has put his all skills in training the needy, in learning the Nadi as well as the Marma. Nadi, Mutra, Malam, Jehva, Shabdasparsha, Durgaktiti, it is the 8 factors we need to test before starting the treatment. Yes, we are taking today the Nadi Pariksha and also the Marma Vignanam with Dr. Naveen Chandra Joshi ji. We have many people here from Madhya Pradesh, Maharashtra, Chennai, Karnataka, and all parts of the nation. I welcome you all to this session and let us enjoy the learning. Moderator ma'am. Thank you. I welcome one and all.
Thank you, Dr. Gopalakrishna sir. Now I would invite Dr. Manjula madam to introduce the speaker.
Good evening, all. It's really a great, immense pleasure for me to introduce our Dr. Naveen Joshi sir. I was the one to learn from him on a COVID time, and he has a very big background. He's a senior medical officer in Panchakarma unit, and profile-wise, he's accomplished. I'm just going to very brief information because we learn more from him. That is the reason. Accomplished academician, clinician, researcher over 2 decades, and his major exactly he has done his MD from Ayurveda Kaya Chikitsa, PG diploma in yogic science, BMS Ayurveda modern medicine and surgery from CJ University Kanpur, BSc in chemistry also. I think this must have helped him to go further in more detail about it. Professional wise, he's an associate professor in Harawala campus, Uttarakhand Ayurveda University, assistant professor Harawala and Gurukula campus, senior medical officer, present he is, in a government Ayurvedic hospital in Panchakarma unit, Majra Dehradun, medical officer, Victor Dehradun. ಎಷ್ಟಿದೆ ಅಂದರೆ ಓದ್ತಾ ಇದ್ರೆ ತುಂಬ ಇದೆ, but still small. Assistant professor, Uttarakhand Ayurveda College, Dehradun, as I told you already. And research publication, when I went through, sir, it was really shocking. I was just thinking you are only with Panchakarma, Marma or Pulse. But what I saw here was, madam, we have to call sir once again in this aspect. He is a patent organic he has done in Dupam cake for indoor microbial reductions wise, and preclinical and clinical studies on Carcia papaya leaf extract, current traditional medicine, that also is done in 2020, and patent herbal ant and mosquito repellent cream and gel. I think this also you had to cover, sir. Next, we definitely call you for with the guidance of our Yojak Samiti people and madam permission. Books also as a polycystic ovarian disease, Ayurvedic management, therapeutic to gynecological diseases, and he has worked with Apollo Hospital. That is also an excellent one. Our Dr. Jayashree madam keeps talking. We talk about Ayurveda, we do a lot of work in Ayurveda, but what about modern concerns wise? We have to work with them also, and whereas sir has done that. Awards wise, Best Doctor Award from Government Uttar Karnataka, Sanjeevan Puraskara, Ayurveda Bhushan Award. Lot more is there. I don't want to take much about all these things. I am excellent with my therapy because of sir. Anytime you call up, he is there. And the way he teaches is excellent. Even if I remember Gulfa Marma, he made us on the COVID online. pull your laptop, show me how you people are doing, show your face. Means the action, reaction of the point, how we do it is what is necessary. And every time I keep talking about you, sir, about pulse. Pulse reading, exactly. My patients are really shocked. How do you know? I thank at that time one of our sir is there, Dr. Naveen Joshi. I might have told 1,000 times to Jayshree Madam about this. So we try to bring you today, at least to see you today, and you have to guide us and prolong this, sir. This is a small introduction what I am giving. What all he has given, I have not covered anything. He is an excellent teacher, master. Till you learn, as Jayshree Madam, he will hold your ears, pinch your ears. Thank you, sir.
Thank you. Thank you.
Madam, finish
Thank
my.
you, ma'am.
Yeah.
Thank you, Manjula ma'am, for introducing the speaker. A special thank to our today's esteemed speaker, Dr. Naveen Chandra Joshi, sir. All your presentation is going to make this today's event a very special one. Now the dais is yours, sir.
Thank you, ma'am. Thanks to all of you, especially I am very much grateful to Dr. Jayashree ji and Dr. Manjula ji and the team members, Tribhuvan Holistic Foundation. And I personally, I am very much positive, and I think that the session will give some brief introduction about the Marma Chikitsa and Nadi Pariksha. Actually, you all know me, maximum of Dr. Manjula already joined my session previously during the COVID time. And I think Jayashree ji also joined at that time. That is a very dark era of this, I think that this decade when everybody is locked in their house and the online teaching started on that time. So first when I started to teach Marma Chikitsa, many people asked me how Marma Chikitsa can be uh, explained through online methods. And from that time to this time, still I am teaching the Marma Chikitsa. And after 6 months, I started teaching Nadi Pariksha. Then again, the same question arises: how the Nadi Pariksha can be explained, or it is totally transferred to people through online methods. But still, last 5 years continuously, I am teaching, and I think that 30,000 students directly I just transferred this knowledge to the participants. So I pay my pranam to Lord Dhanvantari and Lord Shiva, and I start my session with one sutra, that is Natuham kamaye rajyam na swargam na cha punarbhavam kamaye duktaptanam praninam aratinasanam. This is the main motto of this Nadi Pariksha and Marma Chikitsa session. Means nothing, I don't want nothing, I just want to treat my patients, and this knowledge is only for the diagnosis and to give proper treatment to the patients. That is the meaning of this mantra. So Nadi Pariksha and Marma Chikitsa, just I start, I don't need to introduce myself, and PPT already there, so already Dr. Mandila already completed this work, and I just, you know that I just extemporary, I present my practical presentation to hands-on training. So Marma Chikitsa, this is a very peculiar word when it comes to your mind, that Chikitsa and Marma. In Sushruta it is explained that Marma Maryanti iti Marma, Maranam Karita iti Marmani. In Marma Nirdesh Sharir Adhyay, chapter number 6. And how it will be a Chikitsa. So during my graduation time, I also think that the same thing, that Marma will be only for protection, to guard our body, that is the vital areas. But I am thankful to my great teacher, Professor Sunil Kumar Joshi sir, to whom I learned this knowledge. Actually, everybody is learned from somebody, like Manjula ji explained, I learned from myself. And I learned this knowledge from my guru, Professor Sunil Kumar Joshi sir. So the Marma Chikitsa is totally a knowledge, divine knowledge. It comes from the Angirasi Vidya. The Angirasi Vidya, we know that it is a method of just touching our points and just before starting the prayer to the God. Ananyasa and the Karanyasa. These two uh, are the part of our daily rituals by which we pray to the God. That is the Angirasi Vidya. So, in the Vedic tradition, this marma, marma stimulation, marma points should be touched in daily routine. But chikitsa and there is this knowledge is not so much organized, not much so much organized. But when we go to the literatures like literatures, please mute your mic. All participants, I request that this meeting link is widely shared. So please mute your mic. Yeah. So in Durga Saptati, there is a sutra. Gulfayo Narasinghi cha Pada Pristhed Tejasi Adanguli Su Rakshesu Pada Adhastalavase. Means the Gulfa Marma. As Vilaji explained already how I am teaching. So, Gulfayo Narasinghi Chapada Pristhe Tejasi. Oh, power God, Goddess, please come and sit on my Gulfa Marma. Narasinghi Swarupa. Pada Pristhe Tejasi. In the just the back side of foot, that is in the side of the Kalirudaya Marma, just sit like Tejasa. Padanguli Sri Rakshesu, between the two fingers, the great toe and first toe, please come, and they just come like Sri Rakshesu, Lakshmi, goddess of the goddess of. You know that just we celebrate the Diwali, the Lakshmi Puja, Lakshmi, and Padanguli Sri Rakshesu, Pada Adhastalavasi. These are the references from small books, small literatures, but we don't get any direct reference that marma should be used in the chikitsa. When we look the name of the marma points, 10 marma, 7 marma points, I think that you all are familiar with this marma points in the final year of BMS when you study the Sushrut Sanghita. Adhipati marma. Adhipati Marma. Why the name Adhipati is given Dr. Jayasri ji, madam? Definitely something is there. Simant Marma. What is the meaning? What is the meaning of Simant Marma? Tal Hridaya Marma. When we look the name of the Marma, like my name is Naveen. Obviously, I am doing new things. Just I am organizing a program in Bangalore, in your city. This is also a new experience for me. So the name is Adhipati, the name is Simant, the name is Vidhur, the name is Indravasti, the name is Tal Hriday. When we look the name and when we look the aspect of Maharshi Sushruta, all the marma points like Adhipati is very dangerous. It is Sadhya Pranahar marma, Agni marma. It is dangerous. But when we look the name and retrospectively we study the marma points, and when we look that this point is related with the crown chakra, then we think that this is a totally control. It can totally control the nervous system. That is the Adhipati. So I start first in this session. I start some marma points which is very useful, and I also give some tips of the Nadi Pariksha. So my session is totally practical. So I start my this practical section from the Adhipati Marma. So Adhipati, the first Marma point. Marma points are 107 Marma points. What is the definition of Marma? That is the Mansa Sira Snayu Asti Sandhi, where they make the joint and where the prana is incorporated. That energy point is known as the Marma points. But in Sushruta it is mentioned Maryantinki Marmani, Maranam Karittvaditi Marmani. Means these are vital areas, these are sensitive areas, but these are very important areas. Like we pray to God, the God's face is very sensitive. We have to keep very safe, very sanctity of the God. So that areas are very sensitive, but they are very effective, very positive for the treatment purpose also. So the Adhipati Marma, it is located on the top of the vertex. This is the vertex. Just look. I think that my video is visible to everybody or not. I don't know. Dr. Jaisriji, I am visible to all.
Yes, sir. Yes,
Yeah.
sir.
So this is the Adhipati. It is at the crown chakra. And when you look, we have to, what we have to do, we have to make friendship with Marma. Yes. So we have to know the biodata, the resume of the Marma points. So Adhipati is only one. Like if our body is our country, our nation, our capital is our head. Yeah. And in the capital, who lives? The administrator, obviously the prime minister or chief minister. So Adhipati is like that. And that is only one. So this is the point. This is only one. And by 5 fingers, Prithvi, earth element, fire element, water element, or Namaste, how to do Marma therapy at the back bicep. Mr. Aulaji, please wait. I will just come to the back. First, actually, this is an introductory session, and I think that you already joined my session. So, Adhipati is the crown chakra point. So, we have to very sophisticatedly use this Marma point. Why? This Marma is Agneya Marma. Agneya means Agni Mahabhut Pradhan Marma points. So, like if you want to make prime minister or chief minister, then we have to take appointment definitely. Nilkantaji, we do not go and directly met with him, and they are very powerful. If we go on the wrong time, definitely we also get negative results. So Adhipati Marma, when we think about this Marma point, when we saw the Ananyas Prakriya, we touched this crown chakra. Why we touch this crown chakra? So that comes that this is the Marma point which controls whole body's nervous system, central nervous system. And this is the Agneya Marma point. That's why it is mentioned that this Sadhya Pranahar Marma. So if we give a more impact on this Marma or direct impact or injury to this Marma point, the person will die immediately. But retrospectively, when you awaken this Marma point, definitely this Marma point will give you a brilliant results like insomnia, like just like you just every condition from head to toe you will get the results of Adhipati Marma. But only thing is that the Marma point should be stimulated cautiously, and especially the Agneya Marma should be stimulated in morning time and evening time. That is the Brahma Muhurt and Trikala Sandhya time. And one thing I also explain all of you that there is some protocol that do not stimulate any Marma during the pregnancy, do not stimulate any Marma in standing position, and always keep this in your mind that our lady during the menstrual period, menstrual time, don't stimulate the Marma points. These are some protocols. And one thing is very important that when you are stimulating a Marma, you are trying to connect and just with the energy. And all the patients who came in your OPD, they are with negativity. So there is chances that if your energy level is low, then there will be chances that negative energy will influence you. So it is recommended that whenever you are stimulating or touching these Marma points, you just put Rudraksha or any such type of Rudraksha is very, very good. You can put in your table or in any part. You don't need to wear it. You can put your table or here and there. So these are the protocols. And first thing is that who is doing this therapy, Marma therapy, that should be more positive energy as you are transferring your pranic energy to the patient. So you must be at the higher side. If you are in the lower side, then there is chances that negative energy comes inside you. So these are some basic protocols. So the Adhipati Marma is the crown Marma It is the supermarma of the head that is at the crown chakra, that is the torcular hierophila. This area is known as the torcular hierophila. You can touch this, and yes, one thing is very important. Some now people are, I am also doing Panchkarma in my Panchkarma or IPD. So during Siro Abhyangam or any type of oil, if you are putting here, you must take care that the oil should be of the cold in nature, not hot in nature. Like if you apply bhallataka tela over this marma, you will get the negative results, 100%. So always keep this in mind. So nature of the Marma is very important. So this is the Adhipati Marma. So Adhipati Marma is one. It is a Sandhi Marma. It is at the torcular hierophila, and it is stimulated with 5 fingers. Prithvi, Jal, Agni, Vayu and Akash. All the 5 Mahabhuts in your fingers. So this is the Adhipati. Now come to the 5 Marma points. That is the Simanta Marma. Simanta. Simantam is a word, Sanskrit word, and Simant means connection. Connect. Cement, nowadays, cement is also a word to connect bricks, to connect the bricks. The same, the word is Simanta. 5 Marma points. So, where these Marma points are located? So, look, this is the coronal suture. So, this suture is known as the coronal suture. There are 2 points at the coronal suture. 1 point is at the sagittal suture and 2 point is at the lambdoidal suture. Lambdoidal suture. 2 at the coronal, 1 at the sagittal and 2 at the lambdoidal. So 5 Marma points. So how we can stimulate this Marma point? First we have to know what is Simanta Marma. Simanta Marma is a big Marma in the size. Sushruta mentioned it is 4 angula pramana Marma, and it is located whole over our scalp, means coronal suture 2, sagittal suture 1 and lambdoidal suture 2. So whenever we are in stress, how we do? Just like this. This is our natural pose. So when we put this Marma points, so we have to do like this. First, put your hypothenar eminence in the end of the eyebrow and above the temple bone, and just put this, and just put your thumb just at the back, and so just press it and release it, 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 press it and release it. By pressing and releasing, you find relaxation. It also helps on the Adhipati Marma, helps to Adhipati Marma, like cabinet ministers are helping the chief ministers. Am I right? Cabinet ministers, 5 cabinet ministers, they are helping to the top of the administrator. Yeah, means chief minister, like Adhipati Marma. So Simanta Marma has same clinical importance as Adhipati Marma, but it is a Soumya Agneya Marma, means it has water element as well as the fire element. So it is Kalantar Pranahar Marma. With injury to this point, the patient or person will die after some time. So this is the Simanta Marma. I am just explaining you the head Marma now. Now come to the Vidhur Marma. Vidhur is just below the earlobe, just below the earlobe. This is spinna, and this is, we just know this point is the mastoid process. So put your thumb below the mastoid process and just click it above. Push here like this. You just push like this, and one click you feel. One click you feel. Yeah. Like a plastic is just crackling. Yeah. Nilkantha's video is visible, so I am just looking him. Yeah, he is doing correct. Yeah. Vidhur Marma is connected with the auditory system. It is connected with the auditory balance, internal ear and middle ear. You all know that cochlea as well as the endolimbs and all the malleus and stapes, these small bones are very important for hearing, and it is also for maintaining the balance also. So we use this Marma point for treating the vertigo, for many patients like the patients who come in Alzheimer's, also Parkinsonism also. So Vidhur Marma is very important. And you all know that Karna Vedan technique we use. This is very important nowadays during Sarat Purnima. Many people do the Karna Vedan as well as the Payasam for treating the asthma cases also. So this is the Vidur Marma. Vidur Marma is a Snayu Marma. One thing we have to take care that which Marma is of which category. Like the Adhipati is Sandhi Marma, Simant is Sandhi Marma, Vidur Marma is Snayu Marma. So Snayu Marma means it is genital Marma. So if you give more injury to this point, like hitting this point, the person will immediately fall down. So in Kalari, I met with the Kerala people also. They just used to hit this point and the person will immediately fall down. So the retrospectively, if we stimulate this Burma point maintain and restore the balances, restore the auditory functions. While if you give injury to this point, opposite effect we just observe. Like we lose our control, we lose our hearing senses. So this is the Vidur Marma. Now come to the next point. So Vidur Marma, we can say that in our body, if the capital of body is head and the supreme leader is sitting here and his 5 cabinet ministers are sitting around the supreme leader, then Vidur is the Marma point by which he got the communication from outside that what is going outside. Yeah. So everything is totally administered in our body beautifully by great God. So this is the Vidur Marma. Now come to the next Marma point. It is called Sankha Marma. Sushruta mentioned that Dhruvo Antaro Rupari Karna Lalato Madhye Sankhau Tatra Sadhyo Maranam. At the end of the eyebrow and at the start of the earlobe, if you draw a virtual line and at the center of the point is the Sankha Marma. Yeah. Usually whenever we are suffering from headache or migraine or any type of headache, we just put our finger here and just start pressing. Yeah. Unknowingly we are already doing this. Yeah. But this is the Sankha Marma. Sankha Marma is a Asthi Marma. It is at the temple bone and it has a direct effect on the Apana Vayu. Yes. You observe that in some very routine if you sometimes there is a delay in the lunch or breakfast, you skip. Sometimes the gas or the Apana Vayu just come above and it started the headache immediately. So if you start stimulating this Marma point, you observe that your headache comes down. This is the Sankha Marma. Sankha Marma is also connected with it is also connected with our perception by which touch perception means tactile sensation. So if you want to uh, develop your skill of Nadi Pariksha, then you must have to be very prominent in your tactile sensation because the Marma is also used from the finger and the Nadi Pariksha is also used from the finger. And your finger are very important for all the Marma Chikitsa as well as the Nadi Pariksha. So this is the Sankha Marma. The Sankha Marma is very important, but it is very dangerous. It is also a Agni Marma. So if you hit this point, the person will immediately die at his Agni Marma point. But it is very effective if you stimulate cautiously. You can get excellent results, especially in the headache, especially in the migraine and other clinical conditions which is related with the Apana Dusti. So now come to the next Marma point. This is the Apanga Marma at the end of the eyebrow. The end of the eyebrow. This is the Apanga Sandhi, but this is the Shira Marma. Apanga. Apanga is related with the your visual senses, means the refractions and other totally connected with the Alochak Pitta. And Apanga is just you think that this is also Shira Marma. So you just put your index finger here and just slightly little bit you just press it and release it, press it and release it, press it and release it. You find that a very cooling effect. You find your vision will improve slowly, and sometimes it is also very effective in treating the patients having some squint-like issues, squint or refractive errors. And we all know that the Panchakarma, we use the Akshitarpana, and all these methods, Panchkarma, they have a direct effect through the marma points. While doing Sirodhara, we also do, we just put the dhara over these points, so Sankha marma, so the Apanga marma, these marma will naturally nurtured by putting oil over these points. So this is the Apanga marma. Now come to the next Burma point. It is Sthapani. Sthapani. Sthapani means to establish, means to recall, to establish, to take decision, and this is at the glabella. So whenever we just put just chandan over this point like this, we are just stimulating our Sthapani. Sthapani. The name itself explains that it is at the junction of the two area between the glabella where all the six nadi passes. One is the Pusha, one is the Gandhari, one is the Eda, Pingala, Payaswari and Sankali. All these nadi passes and just met here in the Susumna nadi. So this is also known as the Agya Chakra, or we can say the third eye. And nowadays everybody is now interested to know how third eye enlightenment is practiced. So in our Nadi Pariksha, we just know that when this Sthapani Marma awakens, you can just observe the Nadi without checking only by the Darsana Pariksha. So this is the Sthapani Marma. Sthapani Marma is very important for decision making, for recalling. So in case of Alzheimer disease, or many of the patients in our coming on our OPD in Panchkarma, I'm also working in a Panchkarma unit, government Panchkarma unit. So many patients are coming there of the Alzheimer's. So we just explain them, we just train them, and even we train to the attendant also, so they can just do this marma point for old age people, Sthapani marma. Now come to the next marma point. It is 4 in number. That is a Sringataka. Sringataka. Sringataka is a Sringataka. Sringataka means what you just know, the water chestnut. Water chestnut is a fruit which is in we used to take it during some special occasion. This is a very I think that holistic food, we can say, and the bone is also looks like the Sringataka, having 4 corners. Sringataka, 4 marma point. One is connected with your visual acuity. Singhada, Sonia Singleti. That is a Singhada. That is, I don't know in Kannada what it is explained in Kannada. In Sanskrit it is Sringataka. In Marathi it is, I think, Singoda or Singodi. In our Uttarakhand it is Sringana. Some like words like this is used commonly. Actually it is connected with the 4 senses. One is the visual, one is the auditory, one is the our smell, as well as the taste. So you observe during the COVID time, many people are COVID positive at that time, where COVID positive at that time, but they haven't any symptoms, but they lost their smell, they lost their vision, they lost their taste. Actually, this is due to the Sringatak Marma. So Sringatak Marma is just located here, the inner canthus of the eye. So how we can stimulate? We have to just put our thumb and index finger here and just give slight pressure over the spine, and by putting this slowly, we can feel the relaxation. And this is very important, very effective for sinusitis, for rhinitis, for sense of smell, sense of taste, sense of hearing senses, all the 4 senses. It controls and it maintains. So this is the Sringataka Marma. And the final marma point of the head is the Fana. Fana. Fana means the serpent hood. Like 2 serpent hood are present here. Like they are just working like a guard. So do not allow the negative things inside and positive things inside. So the Fana marma is at the ala nasi, and you can stimulate the marma point by just putting your small finger here, like this, like this, like this. This is very good for snoring. Many people have problem like snoring. Yeah, so this is very good for snoring. for the nasal blockage. In certain cases of the smell related issues, we treat, and all you know that the Nasya Karma is just done from the Pada Marma and Sringatak to the Pada and Sringatak Marma. So all the Marma points, the important Marma points I explained of the head from Adhipati to Pada. Adhipati is 1, 5 Simant, 2 Vidor, 2 Sankha, 2 Apanga, 1 Sthapani, 4 Sringatak and 2 Pada. Complete. Okay. Now come to the neck Marma point. My session is totally practical. You all know that I'm not very much interested to present in the PPT format. So I am already a PPT who is demonstrating in front of you. So now come to the neck Marma point. Neck. The neck is very sensitive. So we don't use to directly stimulate this Marma point. So this is the vocal cord. So in the side of the vocal cord, the two Marma point that is known as Neeladhamani. Neeladhamani. Neeladhamani is a very important Marma point which is just associated with the Udana and Prana Vayu. So some people have or some child has some problem like stammering. They do not clear their voice, there's dyslexia or speech disorders. So in this issues, we just do not directly stimulate. I will tell you how to just stimulate this Marma point later, just after just explaining all the Marma points of the neck. So this is the Neeladhamani. Manya is two Marma point just at the angle of the mandible. This is the Manya. This is the Manya. This is very sensitive, so we do not stimulate this point to another person, but I will teach you how to stimulate your neck Marma point. And 8 Marma points of the Sira Matrika. This 4 and this 4. Yes, is directly associated with the carotid artery and thus the jugular veins. So this is very important. If you put more pressure over this point, the patient will come on the coma. And Kalari or Kerala people, they used to demonstrate some such type of the activities on the animals to impress the martial art technique. This is actually, they just put pressure over this point. This is known as the Matrika Sira. These are 8 Marma points. So you do not have to directly stimulate how many times we need to stimulate any specific time. If you are healthy, you have to stimulate 5 to 8 times. And if you are having some problem related with any body or if you think that this Marma point is specific for this disease, then you have to stimulate 15 to 18 times. 15 to 18 times. But neck Marma should not be directly stimulated. You have to do positive pressure technique, like just, or negative pressure technique, like this. I just explained this as a 2 mudra. One is Hanuman mudra and one is the Kali mudra. So Hanuman mudra and Kali mudra. Or we usually just blow the Sankh or the just Panchajanvi. So by doing this, already we daily stimulate our neck Marma point. So no need to stimulate what is the position of the head while stimulating? Head should be straight. And yes, I already explained that Marma should be stimulated in sitting position. So always sit in sitting position. If you are having comfortable in sitting in Vajrasana, it's good. If you are comfortable in Padmasana, it's good. And if you are not comfortable in sitting or you are suffering from osteoarthritis, then you can sit in kursi asana, chair asana. That is also okay, no problem. So as comfortable as you can stimulate, but never do any stimulation of Marma in standing position. Always remember it. So your head and neck Marma is now, I think, that complete. Now come to the back side of the neck. That is 2 Marma point. This is at the back side. Just I am showing you this is the alento-occipital joint. This is called the alento-occipital joint. Means the junction of the above our just back and the neck, and that is called the alento-occipital joint. So at the alento-occipital joint, there is 2 Marma point that is known as the Trikartika. So how you have to stimulate? Just put just like this and just go and just put this at the back, yeah, and just press it, release it, press it, release it. Guys, must give pressure to this, yeah. This is called the Trikartika Marma. Trikartika Marma. Maharshi Sushruta explained that when you give injury to this Marma point, then chala murdha will happen. The neck will like this. So in reverse pharmacology, if a patient is coming having this side, actually the neck is not stable, you can stimulate this nerve. So cervical cases, in cervical, even in cases of cerebral atrophy, I got a very good results of head murmur and especially the trichotillomania murmur. Cerebral atrophy cases also, you just give here pressure should be with palm or thumb, sir. No, with this hypothenar eminence. This hypothenar eminence. Yeah, this one. This. No, to your hypothenar eminence. Like this. Just do like this. This is the way to stimulate the marble. So this is the Kritika marma. Kritika marma. So this is the neck marma. So Nilidhamni, Manya, Matrika Sira and Krikatika. Is it okay? So head and neck marma is now completed. So now I will explain some short marma points which is very important. Like one is Talahridaya. Talahridaya is very important. So you are practicing or you are going anywhere. Sometimes emergency, you never know that it comes. So sometimes when a person is just standing in or sitting in front of you and he fell down, just you thought that there is some issue related with the high blood pressure, or there may be some syncope or unconsciousness or coma. You just start the stimulation of the Talahridaya marma. How you locate this marma point? Just hold your finger and just where it comes at the center of the just palmar aponeurosis. This is the point. This is called the Talahridaya marma. This is Hasta Talahridaya marma, and the same marma point is also at the Pada Talahridaya marma. This is the Pada Talahridaya marma. Okay? So this is the Talahridaya marma. So whenever we are clapping, actually we are not admiring to other. We are just stimulating our Talahridaya marma. Yeah. So this is the Talahridaya marma. So yeah, it has direct effect on the Hridaya. In Kasyap Samhita it is explained that there are 5 Hridaya. So we don't understand why the Acharya Kasyapa has explained 5 Hridaya. Hridaya is only one. But when we study the marma points, so 2 at our soul and 2 at the palm, and 1 is the actual Hridaya. So 5 Hridaya. So I hope that the Hridaya marma, the head marma, all marma points you clear. Yeah. So yeah, I think you all enjoy. Any doubts you can ask. My first part is the marma, and now the second part is coming. So I don't want to bore you. Actually, my marma lecture is of 15 to 18 days, and I think that this is only a trailer. I am just giving you a trailer. So I think that the trailer is marma part trailer is now complete. So now I'll come to the Nadi Pariksha. Okay. So Nadi Pariksha. So I think that everybody is clear. Whatever marma I explained, Adipati, Simant, Vidur, Sankha, Apang, Stapani, Sringata, Phana, Nilidhamani, Manya, Matrika, Siratrikata. Yeah. So now come to the Nadi Pariksha. Nadi Pariksha. It's a very same way. The Nadi Pariksha is also a very means it is not discussed anywhere. Yeah, you understand that. Oh, he's a very good Nadi Vaidya. Oh, very nice. Nobody has explained it systematically. So, the Nadi Pariksha, if you want to study the Nadi Pariksha, there are some reference books in which the Ravana and the Kanad book is very good. And I personally, when I clinically, how long should we press or put pressure in that particular 0.8 second? Very good question, Priyaji. 0.8 second. Any marma point you have to stimulate at 0.8 second. And Om Namah Shivaya or Jai Sri Krishna, whatever you chant your mantra, it doesn't mean 0.8 seconds should be the time. Okay, so 0.8 second. Why 0.8 second? One cardiac cycle, systole and diastole, it completes in 0.8 second. That's why 0.8 second time should be given for stimulus. And always remember that we do not press any point. Somebody asked that how it is different from acupressure, acupuncture. So in acupressure and acupuncture, we puncture or press at any point, and that is a meridian based knowledge. It is not a meridian based knowledge, and we never puncture or press any point. We stimulate. We stimulate. So that is the difference between the acupuncture. You can say that the mother of the all these type of traditional Chinese medicine, Chinese system, these all came from the Burma. Yes, you go and search in the National Geographical Channel one short video documentary. You got all the information how these knowledge passed to those in the Buddha area. Buddha time, it just passed through the Tibet and then China and the other areas. So the mother of all the knowledge is our Sanatan knowledge, the Vedic knowledge, and the Vedic knowledge is the Angirasi knowledge, and that is the Burma knowledge. So now come to the second part, Nadi Pariksha. Okay, sir, thank you so much. Thank you to you also. Now come to the Nadi Pariksha. The Ravana Nadi Tantra, it explained that Savedena Roga Dhriti Kurpara Bhaga Bhaja Dakshina Karangulika Traida Mangustya Mula Vipaschima Bhaga Madhyam Nadi Prevanjana Gati Satatam Parikshaye. It is mentioned same in the Kanar that you must have to examine 8 things. Nadi, Mutram, Malam, Jivva, Shabdam, Sparsam, Driga, Akriti. We study in our book that Yoga Ratnakar and Sarangadhar mentioned this. But before Yoga Ratnakar, before the Sarangadhar, the Ravana Tantra, it is mentioned that Roga Akranta Sarirasya Sthanam Mastau Parichayet Nadi, Mutram, Malam, Jivva, Shabdam, Sparsam, Driga, Akriti. So Nadi Pariksha is the first examination. So we use commonly the word Anadi. Anadi. Doesn't know the Nadi is Anadi. So Nadi is a very important thing. So every Vaidya must have the knowledge of the Nadi Pariksha. It is very beautiful. Dear participant, please post. Yeah, you can post your questions here. I will give you the answers also. So Nadi Pariksha. It is mentioned that Savivena Roga Dhriti. First, the Vaidya should be very Dhritivan. Purpar Bhaga Bhaja. The Vaidya who want to do the Nadi Pariksha must know the Marma therapy also. Actually, the Purpar Bhaga Bhaja. Purpar Sandhi. It is mentioned in the Ravana. Purpar Bhaga Bhaja. This is the Purpar Marma. At the elbow joint, just one angle towards the wrist, there is 2 Burma point. It is known as the Purpar Bhaga Bhaga. This is mentioned that whenever you are examining the pulse, first you have to press this Purpar Marma. Do you think that any Vaidya, before checking the Nadi Pariksha, is pressing this Burma point? You never see. But it is mentioned in the Ravana. My students always used to practice in this way. They first stimulate the Purpar Marma. Why the Purpar Marma? Purpar Marma is directly connected to your liver, your blood supply, your blood circulation. Whenever a patient is coming in your OPD, so you are examining the radial artery. That is the Nadi. That is the Jiva Sakshani Nadi. It is mentioned by the Ravana. This is the Jiva Sakshani Nadi. So whenever you are examining a river, so you must have to clear the river, clear the water. By just stimulating the Purpar Marma, what you are doing? You are just clearing your blood. But no, you never observe that any Vaidya is doing Purpar Marma. Even many of the Vaidya has no knowledge of the Purpar Marma. Yeah. So, Purpar Marma, Purpar Bhaga Bhaja, Dakshina Karangulika Trayanam, or right hands 3 fingers, Dakshina Karangulika Trayanam. Angushtya Mula, Adi Paschima. Just put your 3 fingers at the Angushtya Mula, Adi Paschima. Adi Paschima means slightly Paschima. And Dakshinikarangulika Trenam Angushtya Mula Adi Paschima Bhaga Madhyam Nadi Prevanjan Gati Satatam Parikshaye. And you have to examine this Nadi, the radial artery first. So just somebody in BMS or in Ayurveda Charya, some student asked, sir, we never see the Vata Pitta Kapha. Where is Vata Pitta Kapha? Where is Vata Pitta Kapha? So I tell them to just observe your pulse. Vata Va gati gandanayo iti vatah. Gati. Just look your index finger pulse. There is a movement. Pitta. Sasneham usnam tikshnam drava amlam saram katu. Pitta. You find all the qualities of these gunas. This pulse is just hitting your finger like this, like this, like this. That is called, later on I will explain you that is how it is explained in these books. And third one, Guru Manda Spirit Lakshana Pichila. You don't want to move. So just observe your third finger pulse. It is very slow. It is very heavy. You cannot find it normally. So observe this. Yeah. So Vata, Pitta, Kapha. This is Ruksha Sito Lagu Sukshma Chala Vishadakhara. Sasneham Usnam Tikshnam Dravamlam Saram Katu. Guru Manda Spirit Lakshana Pichila. All the three qualities you can observe in your fingers. So this is called the nadi. So how this is explained? Actually at that time there is no paperwork, no pen, no paper. So the teacher explained to students, oh, this is Vata. How Vata? Ruksha, Sita, Lagu, Sukshma, Chala, Vishadakara. It is just moving like a snake. Like this irregular movement, horizontal movement. So there is no graph paper, Dr. Neelam. And so how they explain this horizontal? So they explain it with Sarpagati, Sarpa, like Sarpa. In middle finger, the pulse is just bounding upward, vertical. So there is no method to explain to their students, and there is no pen and no paper. So we explain Mandukagati. Frog like leaping, frog like leaping, frog like leaping. And when you observe your ring finger pulse, it is very slow. It is like very cool and calm. So how he explained, actually there is nothing to explain. So he explained it is a Hansagati. Hansagati. So Vata Gati is Sarpagati, the Manduk Gati is the frog like Gati, and the Kapha Gati is Hansagati. So I want to know most of the participants other than who studied Nadi Pariksha from me. When Vata increases, the Sarpagati will increase. When Pitta increases, the Manduk Gati will increase. But when Kapha increases, what happens? Just tell me. The Nadi will increase, Kapha Nadi will increase or not? Please explain in chat box. I will observe. That there is a sentence starting Nadi to be checked in men. In total complete chat is not observed. 1 minute. Is there a sentence starting Nadi to be checked in men in left hand and women it is right hand? Does this have any significance? Yes. It is the same for Marma also. Priyaji, this is same for Marma also. Preferably the females, the left hand Marma should be first stimulated, then right side. And in the same way, the Nadi for the females, it should be preferably examined left side, and in male it is preferably examined right side. Preferably, I use the word preferably, not mandatory. If a female is coming who is not willing to show her left hand, then you cannot force. You can check in the right hand. Yeah. Nadi is very low. Yes. Kapha Nadi is always very low. But it's slow down, sir. Kapha Nadi. Yes, Asaji. It's correct. Yeah, it is guna of Kapha. So when Kapha increases, it slows down. Guru, Manda, Sthira, Slakshara, Pichila. Many of them they do not know what they do, right? Oh, Kapha is increasing. Kapha Nadi is very high. Kapha Nadi is in very high amplitude means Kapha Kshaya. And Kapha Kshaya means Vata Vriddhi. Well, can we get some material before the session on 8th and 9th so that we concentrate on practical aspect on WhatsApp? I will give you, don't worry. So I will send you the PDF on your WhatsApp group. So the Nadi Pariksha. So just now these parikshas, now many people ask that why the Nadi Pariksha is not mentioned in Charak Samhita, Sushrit Samhita, Varbhat Samhita. Some people ask the questions. So the Charak also mentioned that Trivida Pariksha, Darshana, Sparsa and Prashna. So in Nadi Pariksha, the Darshana Pariksha and Sparsa Pariksha are already completed. Darshan as well as the Spars. Okay. And now look the great scientific implication of the Nadi Pariksha. Wait. Just draw the Sarpagati, Mandukgati and Hansagati. First start with the Hansagati. This is Hansagati. This is the Mandukgati, and this is the Sarpagati. What is just what graph you are just observing? This is Hans, this is Manduk, this is Sarp. Look again. This is Hans, this is Manduk, this is Sarp. What is just what formation is going on? Just tell me. Hans, Manduk, Sarp. Tell me. Three-dimensional. And what graph? Yes, ECG. ECG. So you think that ECG is 100 years old institute, now 100 years it comes, and the Nadi Pariksha is the knowledge. How many years back? How they thought this graph in their mind and they explained the Sarpa, Manduka and Hansagati? Now you just explained to the modern people how scientific we are. What your ECG is observing now, that wave is already observed 1000 years back by Raval and Kanar. So QRS complex, yes. Please, the effect, mention the effect period of stimulation of Marma. Yes, Marma should be stimulated regularly. One thing is that. So in follow-up is very essential. Means like there are some disease-like protocols for frozen shoulder. For I just give you some introduction of some Burma point. This is not complete knowledge. The Nadi Pariksha, I just giving you a brief knowledge. Just creating an interest on your mind that this knowledge should be learned, should be propagated. That's why I am just coming here. So I think that you must have to learn this knowledge. Every Vaidya should have to be knowledge. So if you apply this knowledge, you will be Dr. Manjula Jagdish. She is applying this knowledge in her practice. She's already explaining that when I am checking the pulse, the patient will just he's saying how this happens. So many videos are present in my YouTube channel. You go and how I can examine the patients, how I can tell that your gallbladder is removed, how I can tell that your kidney is not functioning properly. So these Usha Ahulaji asking that how stimulate the back Marma points. You repeatedly asking the same question. The back Marma point, when you sit in Usha Ahulaji in Vajrasana position, your Katik Tarun Marma as well as the Nitamba Marma. You have to put actually this is the introductory class. So back Marma, you have to put this thumb on the Nitamba point and just above the Nitam and below the Nitam, then Kukundar Marma. So Kukundar and Nitam you should have to stimulate through the thumb, and the Katik Tarun should be stimulated through the just Vajrasana position. So if you are interested, I will explain it to you. And I have to inform you, I am coming to Bangalore on 8th and 9th of the November. So you will get all these practical hands-on training sessions there. Nadi Pariksha, Marma Chikitsa. And yes, in 6th and 7th, one of my two colleagues are also coming from Kerala, and they are also organizing some Cairo sessions there. So this is a very good union of fusion of the Marma and Nadi, as well as many experts are coming who teach you the Viddha Karma and Agni Karma. That is also important. If you know the Marma point, the Viddha and Agni Karma is also very, very important for you. Why Viddha and Agni Karma? Like I got an accident on 2023, a severe accident. So my L1 vertebra got injured. So I'm not now frequently doing Marma stimulation. I will create pressure over the back. My L1 vertebra got fractured in many pieces. So the implant has been inserted inside, and my bladder and bowel movement is still not proper, and I'm feeling pain. But the Marma practice and the Panchkarma practice is so important that after L1 vertebra injury, nobody is able to even walk. I can show you that I am walking very easily. This is the result of Marma. It's the result of Panchkarma. So always I promote this knowledge. Actually, when I got the spinal injury, I thought that when I take the basti, I take the Shiravala Tel Matra basti, I just used to do the Marma points. So I got immediately result from the pain. Even the bladder and bowel incontinence is there. So this knowledge is very important for all of you. So I request all of you to learn this knowledge. This is a very beautiful knowledge. This increase your practice. It enhance your means this will make you a brand. Yes, brand making knowledge is this. I always tell you that learn Panchkarma, learn the concept of Ayurveda, the clinical concept, but also learn actually what happens now when the patient is coming in our OPD. He wants certain things which instantaneously give you result. So pain management, so by Marma, you can manage the pain immediately. I am not telling you that don't use the medicine. Medicine is also very effective. I also used to give medicine also along with the Marma. So both the means synergistic effect. You will find synergistic effect, and patient will come in your OPD. And the important thing is that the Marma Chikitsa and Nadi Pariksha is not need any equipment, any investment. So you can give this therapy to poor people also. As Panchakarma, you cannot give to the poor people. As it's lot of things are required for Panchakarma. So this is a beautiful gift of great Lord Shiva to all of you. So learn this knowledge, go away and practice. So we are coming with our team on 8th and 9th of the November at Bangalore. So if you want to the detail, I will share you to the foundation's channel. And I welcome to all of you. Already 40 to 50 registrations are already there, and paper presentations are also there. And it's definitely hands-on training session. Basically, all the sessions will be hands-on training sessions, as well as I will provide you the notes and PDF before coming there. And those who already joined my classes, they also I request them to join and learn the practical knowledge, where I will explain you the Gulf Marma. Practically, I will show you. I will explain you how to stimulate all these Marma in sequence. So thank you. I hope that it's, and I hope that I tried my best to explain you everything. Yeah, any question from your side, you can ask.
Thank you so much, sir. It was a very wonderful, awesome presentation. Your enthusiasm from the beginning to the end of this session had made this Google meeting session such a useful, memorable one. I once again thank you, sir. Thank you so much.
Thank you, ma'am. Thank you.
Thank you, sir. Thank you, sir. Now, I call upon Dr. Shiva Arakeri, sir, Professor HOD, Department of Shalyatantra, Taranath Government Ayurveda Medical College,
Sorry.
Bellary, for concluding remarks.
Sorry, QA session is there now if anybody has questions.
Yes, ma'am.
Dr. Priya, you'll have to
Yes,
give-
ma'am. Yes, ma'am. Yes, ma'am.
Yes, dear.
I think Sir has already cleared many of the questions. Only question is regarding the fee someone has asked. I think it will be informed to them. Sir, your mic is muted.
Yeah, the registration fees of that workshop. It is 2-day program and hands-on training program. Actually, we booked the hotel 6 months before. That is the Green Park Organic Restaurant. It is Maleswara. And the 2-day program in which high tea and lunch will be provided. And the registration fees is 2,999, in which all the sessions, workshops, you can participate. We will provide you all the hands-on training workshop session. Marma Chikitsa and Nadi Pariksha will be conducted by me a whole day, and the next day will be of the Vidya and Agni Karma and cupping therapy. It is conducted by Vaidya Ramesh Rajguru from Maharashtra is coming, and 1 hour session will be given for our dignitaries, like any of you who want to present or speak, like one professor from BHU, HOD in pain management, Professor K.K. Pandey is coming from Banaras Hindu University, and 2 or 3 participants, we will connect them with virtually. They are from Canada and Germany, as well as they are all our students. And one is from Bangalore. She is Marma Shari, working in SEM College in Bangalore. So basically the total sessions will be hands-on training session. Only 1 hour session is given for the presentation, 5 minutes presentation, as well as the posters. We receive a lot of posters also, so we will also just uh, conclude this session at 4 p.m. on 9th of the November, as we have to also move. So I request all of you that we are coming to your city, and we hope that uh, definitely this knowledge should be very propagated practically through our team. Yeah, thank you. Any other questions you can ask here? My number is 9410379397 if you want to know. Sir, I am a physiotherapy student. Please guide me. You can join, no problem. Marma Chikitsa is it is a rehabilitation process, therapeutic process. Even we train to the paramedical staff also, our Panchkarma assistant, Panchkarma therapist also. So Marma Chikitsa you can learn, no problem. Yeah. Stimulation of Adipati Marma releases happy messengers, acetylcholine, dopamine, serotonin, your export one. Yes, definitely Nilkantaji. Dopamine, serotonin, all the happy things they come from the Adipati Marma. But one thing always remember, don't stimulate this Marma point at Pitta Kala, means at the mid of the noon or at the midnight. Yeah, that will create a opposite results. Yeah.
There is one question on Varma and Ayurveda parallels.
Varma Marutham Siddha system is very deep, where a Marma can be stimulated in 12 ways, like Thattal, Thadaval, etc. What about in Ayurvedic prevalence? One thing I explained you that in Ayurveda, it is Marma stimulation is not mentioned anywhere. I already explained you. This is totally taken from our Angirasi Vidya Nyasa, and this protocol is developed by our Vedyas itself and many of the previously the practitioners. So just we formulated, we just gathered this scattered knowledge in a systematic way, and this comes from mainly the origin comes from the Sushruta. Yes. My phone number is 97608. I will write here. You can call me. No
Sir,
yes.
Naveen sir,
Yes.
we will put it in our group, sir, your number and your details and all the things.
You
Like
will
it is
find
easy.
everything.
Yeah,
You
there will
will
be no
find
confusions about it.
everything in
Yes.
everything in your group, WhatsApp group. You will get every information regarding me. So don't worry, Manjula ji. I invite all of you to join that Bangalore workshop to foundation, and we invite all of you. And also, we want to learn a lot from your what you are doing. You people are doing great job. I think that this is a foundation which we keep meeting on and on. I hope that same meeting during COVID time also. Yeah, Manjula ji explained me that our Vaidya's meeting is already going on here. So many of you, I just interacted with all of you. So I am very much pleased to meet with all of you. And I also request all of you to join Bangalore on 8th or 9th of the November. At least at the specific the panel session, which is 9th of the November. Many of you to know the Marma and who joined already my workshop. So I think that, but I request all of you to join that session. Yeah.
Thank you, sir.
So, any question more for Aditya ji, Jayasri?
No, I don't question.
So let them join for the session and they can hear to you, practice, and then if there is any
Yeah,
question,
I will
thing now.
I
Now
will
today,
assure
I
you,
think you have given.
I will give you 107 Marmat name by heart and point name by heart. You never forget this Marma point. I assure you.
You have given already. You have given today really, really a lot. So we can go for now conclusion.
107 Marma points by heart. And like me, you can explain it extemporally wherever you are standing. Yeah. I can deliver extempore lectures on Marma whole day and Nadi Pariksha whole day. It is by heart. Yes. Actually, what I'm 5 years I'm practicing same. Manjula ji joined my session 5 years back. I think Jayasri ji during COVID time. That from that time I'm regularly taking classes. So when you practice one thing 1,000 times, definitely you will be master. That is not anything special. When you do same thing on many times, then you will be master. Yeah, simple thing. Yeah. Okay. Thank you, ma'am. So
Sure.
that final time
Thank-
to conclude. Yeah.
Thank you, sir. Now I invite Professor Dr. Shivu Arakeri, sir, HOD, Department of Shalyatantra, Taranath Government Ayurveda Medical College, Bellary, to give concluding remarks.
Namaste everyone. Congratulations, sir. Very happy to see and listening you. It was a great moment for all of us, especially to Tribhuvan family. It was a wonderful session. Madam Jayasri, Madam, can we rename this session as a Marma classes session? I thought this session could be like sharing the slides and explaining the classifications of Marma as we studied in UG and PG. It was more towards practical session. Very happy for the sir. It was a very insightful lecture and wonderful explanation given by you and practical demonstration. It was great session. When it comes to understanding the concepts of Marma and Marma Chikitsa, especially to us Karnataka people, it is quite less what I personally feel. It is being practiced in Kerala, but the knowledge is only limited to the orthopedics and sports injuries, where Kerala people used to practice. But here, as a Shalya person, as a surgical person, I just want to conclude with my words with practical applicability and understanding the structural muscultures and vessels, especially when confined to Marma and Marma sthanas. As Vishruta has said, rightly said that without having the knowledge of Marma, if anyone is practicing surgery, it is like firing in the darkness. Though there are different classifications of Marma, but overall they are the vital structures of the body. For example, when it comes to, it's a very commonly we practice colorectal surgeries here. When it comes to Buddha Marma, it's a vital part where just an injury may cause the sudden shock to the patient, and the understanding of that anatomical structure, especially the perineal raphe, anorectal ring, internal and the external anal sphincters, and the anatomical structures involving the anorectal ring with the levator any muscles. These are all something very different that Acharya Sushruta had this knowledge, very great knowledge. Even modern surgery, when it comes to perineal surgeries or anorectal surgeries, they have just 50 years, 60 years that they have understood these structures like called Langer's lines. Based on these Langer's lines only, Acharya Sushruta has told some different incisions in Buddha Pradesh, especially Langalika, Ardha Langalika, Chandrakara, and Ardha Chandrakara, Sarvatobhadra. These special incisions are specially made and on the basis of these anatomical structures. Having this understanding of structures, especially anatomical structures in Buddha Pradesh, gives the wonderful results, and we can always avoid with this knowledge of Marma. While taking the another example, I can say while taking the incisions over the umbilicus, it's an important to have the knowledge of Navi Marma, where the peritoneum just lies deep to the fascia, because there is a chance that accidental injury to the peritoneum and viscera may happen at any time. Especially while inserting the drains after the surgery, after the laparotomy procedures, strict midline orientation to be maintained. This is a very systematic protocol. Even today we are practicing. Even modern surgeons are practicing. When it comes to Shankhamarma, temporal artery, superficial temporal vein, and middle meningeal artery disease. Middle meningeal artery are the most vital structures there. Injury to these structures causes immediate epidural hematoma, and epidural hematoma may leads to sudden death. So, having the as another, I can give another example like Hridaya Marma. It is nothing but Hridaya Marma Vigata, but now we are nowadays we are calling Hridaya Marma Vigata. So, sudden cardiac arrest where sudden loss of consciousness, breathlessness, and collapse and sudden death. So now this is very common nowadays after the COVID. Cardiac arrest are more, and we just call it as very politely we call it as cardiac arrest. Very interestingly, Acharyas have advocated external cardiac massage for these conditions. See, the concept of external cardiac massage is being practiced in modern surgeons just 200 years back. The scientist called Friedrich Marx, it seems, he was a French cardiologist who has advocated and who has particularly demonstrated the cardiopulmonary resuscitation and external cardiac massage for cardiac arrest. So, having the knowledge of this as a Marmasthana and advocating the cardiac massage in those days, it's a great contribution by our Acharyas. It's a great contribution, great understanding of those structures. See, this is a very important part where we are failing, especially in academics. I'm very sorry to say that we have limited our knowledge to Marma knowledge to only those classifications. Sadhya Pranara Marma, Kalantara Pranara, Rujakara Marma. We just give a classification. We just name the Marmas and Marma Sthanas and some possible injuries we can say. So that is enough for our students. But listening to you and after your lecture, after seeing your demonstration, you made all of us to practice that Marma Abhyasa in your session. It was very interesting part. Thank you, sir, on behalf of all of us, especially Tribhuvan family. My pranamas to my guru, respected Jayashree madam. She's always, she's like a push to all of us, very energetic push to all of us. My respects to Gopi Krishna sir, secretary of Tribhuvan family. It was a wonderful session, sir. Congratulations, I'll be in touch with you. Very shortly, we are going to invite you to our institution. Please accept our invitation. Thank you so much. When it comes to Nadi Pariksha, I am very sorry that the knowledge of Nadi Pariksha for our surgeons, it is only limited to peripheral vascular disease. Of course, there is a TV artery, dorsal speed artery pulsation. That has limited as a surgeon, I don't have much idea. I am not a suitable person, right person to comment on that. But overall, it was a wonderful session. Thank you so much, madam, sir, all of you. Thank you so much.
Thank you, sir.
One second, madam. Sir, are you, Naveen sir, are you conducting still yoga session with Marma stimulating?
Yeah.
Morning you used to do earlier?
Yeah, morning Marma Pranasana sessions, yeah. But
it
now
is still
not
there?
frequently, yeah.
It's not going on. Otherwise, we could have asked our people to join for that. Where
No, surely when I
asanas
start, I will inform you. So Marma
Yes.
Pranasana session is also a beautiful part of this Marma. Yeah.
Yes.
Self-stimulation of all the Marma points in morning time. It will give you a whole day energetic. Yeah. So
I
I
do.
will invite you whenever I start. I will give you the links.
I have continued it. That's why I remembered and I'm
Oh,
telling you,
very
sir. Thank
nice.
you.
When,
You are
when
continuing.
sir comes to
Invite me.
Ballari, all of us will go to Ballari. It's more nearer to us with Dr. Shiv.
Sure,
Yeah.
sure, sure.
Great, yeah, madam.
That is an integration we have, sir. See, Priya Ranish, she is coordinating, hosting the program from Nagarkoil, Tamil Nadu.
Thank you, ma'am.
And Dr. Shiva, our Shivu Arkiri, we only call him Shivu. So he
Okay,
is from Ballari. It's good. And you are talking from Dehradun. No,
great, sir.
thanks to the technology and also the
Yeah, I
advancement
am
in
from
science and all.
Himalaya.
Yeah.
You are from east to west, connected.
Yeah. And there are many from different parts of the country.
Yeah.
Yeah.
Thank you.
Yes.
Madam, we have a formal session next. Priya, ma'am, please take over.
Yes, sir.
Yes.
Thank you, sir. Thank you, sir.
Thank you. Thank you, ma'am.
First, I would like to thank this Tribhuvan family for giving me this opportunity to serve as moderator in this valuable session. And I also ask sorry for not being able to have my camera on due to some technical difficulties. Kindly apologize me for that.
Don't worry.
And the session, Dr. Naveen Chandra Joshi's session was really such a wonderful one. It was like just refreshing our Marma Sharira Sthanam, Sushruta Sharira Sthanam, Marma Sharira Madhyayam. Really, sir, it was such a wonderful session. And you shared all the valuable sutras and basic definitions of marmas, starting from Adipati, Simanta Marma, and Tala Marma, then Vidura Marma, Shanka, Apanga Marmas, Tapani, Shringataka, and Kanta Marmas like Neela Marma, Trikatika, Tala Marma, Purpara Marma, etc. Really, the session was really a wonderful, useful one. And I also thank Jayashree Madam for appointing me as a moderator so that I listened that session fully. Really, thank you, Madam. Thank you so much. And I also thank Dr. Shubhashri Madam, Dr. Tripathi Sir, Dr. Ramesh, Principal of Amrita College, Dr. Suvendu Raut Sir, Dr. Aruna Madam, Dr. Guru Basavaraja Sir, Dr. Jagadish Yaji Sir, Dr. N.M. Rudra Gowda Sir, Vice President of our Tribhuvan family, Dr. Smita Vajpayee, Dr. Chakravarti Sir, and Dr. Syed Atar Fatima Madam, former Principal, TGAMC, Bellary. And there is one very important announcement that there is an international seminar as discussed in this session, International Conference on Ayurveda, conducted by Ayush Darpan Foundation and Himayu Care. And the experts like Naveen Chandra Joshi sir, then Rajan Patankar sir, Pandey sir are there to give us a hands-on experience on Viddha Karma, Agni Karma and Nadi Pariksha. So those who are interested can register through Google form, which will be shared very soon in our Tribhuvan family WhatsApp group. And thank you so much. Thank you, Jayashree Madam. You are like what to say? You are like a beacon, ma'am. Beacon of light in many times of in all our times of confusion, and you are a gift to our life as well as for this Tribhuvan family. Once again, thank you so much, ma'am. Thank you, Shiva Arkiri sir, Naveen Chandra sir, Manjula Jagadish madam, and all the persons who actively participated in this session.
Thank you. Thank you. Good night.
We thank you, Priya Madam, also for her efforts and time. With that, I think we can conclude the formal session. Thank you, Naveen sir, for that. We'll share the details of your 8th and 9th program in our group, and hopefully we get more people to join and get your use and utility of it.
Good night.
Thank you. Nice meeting you.